live in Greenville, South Carolina. I'm 52 years old. I have 3 children and also have grandchildren as well. And currently I am living with IgA nephropathy. Before I was diagnosed with IgAN, I had a very active lifestyle. My wife and I own a couple preschools, so we stayed very busy with that, played golf on the weekends, did a lot of handiwork. All of a sudden, things changed for me. I started having headaches, extreme fatigue, body aches, blurred vision. It impacted my life so much that I honestly could barely get off the couch. I was totally healthy up until this point. And so, but I knew there was something going on with my body that I just really couldn't explain. I first went into my internist. He ran a lot of tests, and that's when he found that I had protein in my urine. At that time, he referred me to a nephrologist, and my nephrologist felt like I needed to get a kidney biopsy. After my kidney biopsy, my nephrologist gave me a call, and he explained that I had IgAN. He described IgAN as a rare autoimmune disease that could potentially lead to dialysis or a kidney transplant. We had a discussion about what the treatment options were, and that's when he recommended TARPEYO. He explained that TARPEYO targets the source of the disease in the gut where IgAN is thought to start. You take 4 capsules in the morning. It was a 9-month treatment course, and I was really excited. I didn't have to watch and wait for my disease to progress. It made me have a lot more confidence in my treatment options. We had a discussion about the side effects, which was a concern of mine, especially since I work in a public setting. And after the discussion, we both felt that the benefits outweighed the risk, and we felt really good about moving forward. My doctor filled out the enrollment form. I signed it. TARPEYO Touchpoints contacted me to set up the delivery and have insurance to my work. And so it was a zero copay for me. During the first 2 to 3 weeks, I did experience side effects. I was worried that I was going to have to stop or discontinue the treatment. However, I went in to see my nephrologist, and he came up with a solution, and I was able to move forward. After 3 months of taking TARPEYO, I was scheduled to go in and do labs to see where my protein was, but I didn't see any reduction in protein in my urine. And so at that time, my nephrologist explained that I needed to stay on it for the full 9 months. I'm really glad that I stayed with TARPEYO because at the 9-month mark, my protein had reduced and my eGFR had stabilized, which is in line with what clinical trials have shown with other patients. Not every patient is the same, but this is what happened with me. I was really fortunate to have a nephrologist that was very responsive. I'm really glad that I stuck it out with TARPEYO for the full 9 months. My nephrologist listened to me. He paid attention to my concerns and my needs, and he said that TARPEYO did its job. After this journey, I feel like right now my IgAN is in my hands.
Important safety information. Do not take TARPEYO if you are allergic to budesonide or any of the ingredients in TARPEYO. See the end of the patient information for a complete list of ingredients in TARPEYO. Before taking TARPEYO, tell your healthcare provider about all of your medical conditions, including if you have liver problems, plan to have surgery, have chickenpox or measles, or have recently been near anyone with chickenpox or measles, have an infection, have high blood sugar levels, prediabetes or diabetes, have glaucoma or cataracts, have a family history of diabetes or glaucoma, have or have had tuberculosis, have high blood pressure, hypertension, have decreased bone mineral density, osteoporosis, have stomach ulcers, are pregnant or plan to become pregnant. TARPEYO may harm your unborn baby. Talk to your healthcare provider about the possible risk to your unborn baby if you take TARPEYO when you are pregnant, are breastfeeding or plan to breastfeed. It is not known if TARPEYO passes into your breast milk or if it will affect your baby. Talk to your healthcare provider about the best way to feed your baby during treatment with TARPEYO. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. TARPEYO and other medicines may affect each other, causing side effects. How should I take TARPEYO? Take TARPEYO exactly as your healthcare provider tells you. Your healthcare provider will decide how long you should take TARPEYO. Do not stop taking TARPEYO without first talking with your healthcare provider. Take your prescribed dose of TARPEYO one time each day in the morning, at least 1 hour before a meal. Swallow TARPEYO capsules whole. Do not open, chew, crush, or break TARPEYO capsules before swallowing. If you miss a dose of TARPEYO, take your prescribed dose at your next scheduled time. Do not take 2 doses of TARPEYO at the same time. If you take too much TARPEYO, call your healthcare provider right away or go to the nearest hospital emergency room. What should I avoid while taking TARPEYO? Do not eat grapefruit or drink grapefruit juice during your treatment with TARPEYO. Eating grapefruit or drinking grapefruit juice can increase the level of TARPEYO in your blood. What are the possible side effects of TARPEYO? TARPEYO may cause serious side effects, including effects of having too much corticosteroid medicine in your blood, hypercorticism. Long-time use of TARPEYO can cause you to have signs and symptoms of too much cortisol, a stress hormone in your blood. Tell your healthcare provider if you have any of the following signs and symptoms of hypercorticism: acne, bruise easily, rounding of your face, moon face, ankle swelling, thicker or more hair on your body and face, a fatty pad or hump between your shoulders, buffalo hump, or pink or purple stretch marks on the skin of your abdomen, thighs, breasts, or arms. Adrenal suppression. When TARPEYO is taken for a long period of time, chronic use, adrenal suppression can happen. This is a condition in which the adrenal glands do not make enough steroid hormones. Symptoms of adrenal suppression include tiredness, weakness, nausea and vomiting, and low blood pressure. Tell your healthcare provider if you are under stress or have any symptoms of adrenal suppression during treatment with TARPEYO. Risk of immunosuppression. TARPEYO weakens your immune system. Taking medicines that weaken your immune system makes you more likely to get infections. Avoid contact with people who have contagious diseases such as chickenpox or measles during treatment with TARPEYO. Tell your healthcare provider right away if you come in contact with anyone who has chickenpox or measles. Consult with your healthcare provider regarding appropriate vaccination scheduling. Tell your healthcare provider if you develop any symptoms of infection during treatment with TARPEYO, including fever, feeling tired, chills, aches, pain, and nausea and vomiting. The most common side effects of TARPEYO include swelling of the lower legs, ankles, and feet, high blood pressure, muscle spasms, acne, headache, upper respiratory tract infection, swelling of the face, weight increase, indigestion, irritation or inflammation of the skin, joint pain, increased white blood cell count. These are not all the possible side effects of TARPEYO. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information.